Good afternoon, ladies and gentlemen. On behalf of the MDTC, I'm Diana Kaywood. Today we are fortunate enough to be able to have a professional expert, Tammy Rockhold, who is going to be discussing with us unbundling of surgical codes, and more importantly, how is it that we decipher medical bills when we get in them, and how do we understand the true value of these bills? And so Ms. Rockhold is going to address those issues for us today. And before I introduce her, I would like to just say a thank you to the professional liability and healthcare section. They are the ones that are responsible for bringing this presentation to us today. With respect to the non-members who may be here, I would encourage you to consider joining. The MDTC is an amazing organization that assists defense attorneys across the state of Michigan. They have so many resources available, including a publication that comes out every quarter. It is geared towards keeping lawyers on their toes as it relates to changes in the law or the court rules. They have a listserv that is one of the busiest that I've ever seen. It is a wonderful way for attorneys to exchange ideas as they come in, whether it's looking for experts, documents, depositions, etc. The list goes on literally with what's available. So I would definitely encourage you to consider membership. And with respect to those that are here that already are a member, I would just encourage you to get more involved. There's many committees, certainly some that would appeal to your sensibility, and the organization grows bigger and better with people like yourselves that get involved. So with no further ado, I would like to introduce Tammy Rockhold. Tammy is an expert in billing and coding. She has been so for over 18 years. That is her main specialty. Tammy presents and lectures to attorneys across the country. We're fortunate that she was available to be with us today, especially in the state of where we're at with fee schedules and bundling issues. In addition to her work as an expert, Tammy's been an RN for over 30 years. She is active in SIU departments with various insurers with a real strong focus on fraudulent billing practices. She's even had opportunities to work with some prosecutorial government agencies in terms of uncovering the fraud and determining what any given government agency would determine to do once they determine that in fact there is fraud. So she's active, she's busy, she's engaged. I, for one, am very much looking forward to the presentation. And with that, Tammy, take over.
Okay, I'm looking forward to this. And Jen is going to do the slideshow for me. And let's go ahead and pull it up. And today I want to talk about the legislative update for 2022, as well as unbundling of surgery codes. And looks like we're not quite there yet. Hit play. Okay, here we go. When I'm testifying to a jury, what I like to say is CPT codes are put out by the American Medical Association, and they're a little bit confusing, but they all have a meaning. And if you ordered a Happy Meal, would you get up to the cash register and they'd say you owe for the Diet Coke and French fries and Happy Meal? Are you going to pay for it? No, you're not going to, because Diet Coke and French fries are part of the Happy Meal. The same thing that happens in medical bills, where treatment providers bill for codes that have been done, yes. However, they are already included in another code. So the agenda for this is background and introduction, deciphering medical bills, transparency, why is this important, and then codes that are frequently unbundled. And I'm going to go over surgery center unbundling, surgery center comparisons, unbundling and spinal injections, unbundling and shoulder surgery, unbundling and knee surgery, unbundling and spinal surgery. And there's some helpful tools. And it sounds like a lot of information, but what I've done is I've got examples for you. So when you are reviewing in the future, like a knee surgery, if you see some of these codes that are on here, that might be where you might want to have it reviewed because of some unbundling issues. Next. Okay, deciphering medical bills. Here we go. Why do we do it? Next. Why do we audit bills? They might be inaccurate. I was just at a conference last month. I was supposed to have a room rate at the hotel for a conference of $279 per night. And look at this bill. My room rate was not $279. It was $369 and $429 and $409. And number one, I have a budget, and so is my powers that be going to pay for a higher rate? I don't think so. So I pushed back, and then we got it readjusted. Next. So the charges added up to $397, and total charges that were overcharged was $981. And so we all audit bills on a regular basis. How many of you look at your grocery receipt? How many of you look at the gas pump, etc.? Next. Some transparency. This is some items that a lot of people are not aware of that are throughout the United States, not just in Oregon or California, but throughout the United States. Next. And a law that passed this last year, January 1st, 2021, is that all hospitals have to publish information for transparency for a charge master, not only the amounts that they bill, but the amounts that they will accept for self-pay, and also like what they accept by United Health, travelers, etc., etc. So I just want you to know, and I put in the actual Federal Register number, and if you want a copy of that, I can send it to you after this presentation. Next. Okay, one thing that you'll see when it's an overnight hospitalization, I think most of you are aware of CPT codes, which are put out by the American Medical Association, but are the DRG codes, because anytime there is an overnight hospitalization, hospitals bill by DRG, and that's how payers pay. And so you get that bill from the hospital, that summary bill, and it's clear down on box 71. And this is something that you can easily look up to find out what would be a reasonable value. Next. Okay, here's a transparency law that health plan transparency helps consumers know the cost of a covered item or service before receiving care. What I think is really good about this is that it's really important for you to know what you are going to be paying for. And I just think that the whole law is so good, and it's something that most people are not aware of, and it's something that for sure plaintiff attorneys are not encouraging us to know about this. Next. So here, as of January 1st of this year, a new law went into effect for Federal No Surprise Act 2022. And there was actually a research study done in California that found out that 20 to 25% of all bankruptcies were due to medical bill bankruptcies, like surprise medical bills. And this new No Surprise Act is something that I'm encouraging all my patients when I do patient advocate work to be aware of. And it bans out-of-network charges, because what happens sometimes is a patient goes in for a knee surgery, they make sure that their hospital in network, their surgeons in network, and then they get to the bill from the anesthesiologist, and it's $10,000, and they're, say, Blue Cross might pay $1,000, and they're left with a $9,000 bill. And so this is really good for the consumer. And state billing laws still apply, but the federal act provides a floor of protection. And I think that it's like 30 states out of the 50 have some kind of state law, but this is really good that it's for the entire United States now. Next. Okay, I do a lot of work in California. I do a lot of work in Michigan, but what I've been doing in California is that, because of this law that went into effect January 1st, 2021, to see if the hospitals are compliant, I'm actually doing a compliance test or compliance check. And I have started doing this in Michigan as well. So if you want that information, let me know. Most hospitals have some degree of compliance, but right now in California, I've done 22 hospitals, and only 2 of the 22 hospitals we've reviewed so far are totally compliant with the law that went into effect January 1st, 2021. Next. Okay, we really see how transparency can really be helpful in personal injury. And one thing, this is something that you can have your secretary or paralegal do. It's something I can do, but it really can make a powerful statement and help a case settle. And every hospital has its charge master. So what I'd like to do is look at the hospital's charge master, see what they have billed on their itemized billing to the auto carrier or the work comp carrier, and then look at what the charge master actually says. And when we go to the next slide, you'll see where there can be a huge discrepancy. And so what I have here is, this is a UCR charge master CPT comparison. The CPT code is a 5-digit code that's put out by the American Medical Association. So what I have here on the left is a CPT code that was actually on the bill that was sent to the carrier, and what the description is, and then the amount that was billed by the hospital, and then the amount that was on the charge master. So look at the first one, 99284, emergency department visit, and the hospital on the bill that was sent to the carrier, I think this one was a Farmers, was $3,754. And then if you look at the charge master, you'll see that the highest one for even a level 5 is $1,998.17. There's a little bit of a discrepancy there. Look at the next one, 80048. That's a metabolic panel. That's a blood test that gives you a lot of the electrolytes. On the itemized bill by the hospital to the Farmers, it was $853.75. However, when you go to the charge master that is on the web that every hospital has to have, and most hospitals have had that for a number of years, look at the pricing. The most expensive one is $195.81. Anyway, and you can see as it goes on down. But the hospital billed well above their own charge master, and it was great because I was going over this during my deposition, and after the deposition, the liability, the specials, they settled to my numbers to the penny. They did not want me in the courtroom. So anyway, next. Okay, here's another one where you can see on the left, we have the CPT code that was on the usual and customary, the description, and then look at the amount billed by the hospital, $726, the amount on the charge master, and then this one where the charge master description, and then it's hard to see over to the right, but the default price for cash pay is sometimes like almost half of that. And so the hospital, again, you can go through all of these, they billed well above their own charge master, and disclosure of this led the plaintiff to settle the case. Okay, next. One thing that I'm also starting to do that seems to be really powerful is doing a surgery center comparison to local hospitals. And the original theory was for patients that were low risk to have their surgery done in a surgery center, so that it was in and out, and usually it was simple, and usually it was a much lesser cost than a hospital. And the reason is because when you look at, if you're in a day surgery center and there's a medical emergency, bottom line, they have some resources available, but bottom line, they call 911, have an ambulance take you to the hospital that has all the bells and whistles to actually be able to resuscitate people. And so again, you would think that hospitals should have higher prices, but we're finding that the actual results are quite different. So let's go to the next slide and I'll show you a couple examples. Okay, I'm sure that Radiant Surgery Center, the bill, it was a 62290 injection for spine disc x-ray. They billed $29,000. However, when I looked at Panorama City Medical Center, as well as Providence Tarzana, and this is California, the pricing for that CPT code 62290 was at one hospital $1,396 for cash price, and the other one was $725, a little bit different than $29,000. Down below, we have a surgery center in Michigan that I'm sure some of you are familiar with. And so what you'll see is that Associated Surgery Center, they bill, let's take the first code, the 22867. That's for the stable device with decompression, $105,000, and it's lumbar single level, $105,000 at Associated Surgical Center. Now, at Beaumont Hospital in Dearborn and Henry Ford Medical Center in Fairlane, again, this is public information that anyone can access by going to the website. You will see for that 22867, Beaumont Hospital had it for $898 for cash price. Henry Ford Medical Center had it for $750. You see where sometimes this backup information is really very easy to do. And there's a question, a hospital has to, what was the question again? It came on and then it went off. Diana, can you read it to me, or Matt? I think, go ahead.
I can't see it anymore. Maybe he could ask it again.
I can see it. It says, must a hospital surgical center post its charge master for the public to review, or is this something that must be obtained in discovery?
No, the answer is all hospitals have to disclose all of their pricing, both for what they bill as what they will accept for cash pay and by different payors. However, surgery centers do not have to. Am I answering the question? Okay, cool. All right. Okay, so anyway, this is something that is really powerful because you can see that when you show these numbers where, I can also attach the link and a plaintiff attorney can go to that link and see that the prices are just egregiously overpriced. The cases seem to just really settle. Okay, next. And I know I'm going over a lot of information, and you will have this information for you afterwards, so you can go through this and study it or ask questions further if you want. Okay, the next one is, a lot of you see the injections cervical one level of a 64490 and 64491. This was in California, Specialty Surgery of Wilshire. And then they billed $15,000 and $14,000 for the second level. And then look at LA USC Medical Center, $2,680 and $941. And then at Southern California Hospital, Hollywood, 64490 was $7,840. So I just wanted to show that there is so much discrepancy, and this is something that you do not need to hire an expert for, because it's all public information. And I encourage people to want to just do this on an ongoing basis. Okay, next. Why do we audit bills? Let's go on to the next slide. I think we're finding why we want to. Here's where I was talking a little bit about the language of medical billing, about the CPT codes, which are the professional procedures, the HCPCS codes, which are ambulance, durable medical equipment, prosthetics, etc. And then the diagnosis codes, the ICD-10 diagnosis codes. These three are the components of the language of medical billing. And these are put out by the American Medical Association, and they are very specific. So when someone will say, well, how are you, Ms. Rockwell, making this up, blah, 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 I'll say, I am just enforcing what the rules are that the American Medical Association has put out. And so it makes my job fairly easy. Next. Why is this topic so important? Surgery is expensive. Even when it's coded and billed correctly, it's still expensive. And then the unbundling, particularly in surgery, can add tens of thousands of dollars to the bill. And what I'm seeing is that there are very high prices and unbundling, and it's very common in the personal injury centers cases that I'm seeing. And I think we'll see where care is being done on a lien. Care is being done when a physician might have partial ownership of a surgery center. I mean, there's a lot of different things that are going on that play into this. Next. Okay, these are some frequently unbundled codes. And these codes are so frequently unbundled that I think these are 4 codes that you should check. And if you see these codes, they are unbundled. I would, bet you a bottle of wine that these would be unbundled, that they are not appropriate. The 99080 is a special report or form. And many doctors bill this at every single office visit, where they will see the patient and they'll bill like a 99213 or 99214, and then they bill a special report or form. The only time this code at 99080 is appropriate is when, like, it's for comp, where they have to fill out a special form each time. Or maybe the attorney has asked for a special report, but the documentation from the doctor's visit should reflect in the notes, and you should not be billed for a special report. The next one, 77003, floral guide for injections. I see this all the time, and this can add thousands of dollars, where you will have both the pain management doctor billing it as well as the surgery center. And the next one as well, 76000, fluoroscopy examination. And then the last one, 69990, microsurgery add-on. Yes, these are all codes that are being done during a procedure, but they are part of another code. And I just go back to the Happy Meal example, because when I'm talking to a jury and you talk about unbundling, sometimes they just kind of glaze over. But when you say it's like a Happy Meal, if you order a Happy Meal, you are assuming the Diet Coke and French fries are part of it, not to be billed separately. Okay, next. Okay, what I see a lot as well is a person will go into have a surgery, and there's a surgery center facility fee, and it includes all of these items. And think about when you see a surgery center bill and a doctor's bill, those two bills should mirror each other. And so when they bill for like laboratory testing or drugs or equipment, surgical dressings, or the implants, or anything that is implanted into the body, all of that is included in the surgery center facility fee. And you see a lot of time where surgery centers will bill, besides just the codes for the actual procedure, they will have another 20 codes that are unbundled that can add up to another $10,000 to $50,000. So this is something that I really want you to be aware of. Okay, next. Okay, radiology is also included, and the monitoring includes supplies for the administration of anesthesia. And what I just want you to be aware of is if you have a question, you know, just, I know I'm shooting a lot of information at you and it's like a different language, but if you have questions, let me know, because no question's a dumb question. And the more you learn, then the more you know how to more effectively utilize experts, as well how to, you know, really argue your case properly. And like I said, it's not uncommon to find facility fee billed and with some or all of these items. And, you know, so I'll sometimes have 2 codes that I'm allowing. I'm disallowing 18 codes because they are being unbundled. I mean, I had one where I put in, they were unbundling everything but the kitchen sink. They were even billing for the 4x4s. They were billing for the electrodes, for the heart monitoring. It was just, it was crazy. Okay, next. Okay, there are some what's called pass-through codes that can be billed in addition to the facility fee. And the list that is here are the ones that are active pass-through codes. And then inactive codes will show an expiration date, and the italicized codes have a preliminary pass-through. And so when you see some of the codes, they're called pass-through, there will be some that they can bill separately, but they're very few. Let's go on to the next page and that will give you an example. So here's a current list of some of the pass-through codes, you know, where it's very specific types of endoscopy or a very specific type of orthopedic drug or something, or a probe. Next. Okay, unbundling spinal charges. What we have here in the next, I'd say 15 to 20 slides is a lot of information, but what I want you to do is we're going to go through some of them, but I want to kind of go through the bottom line. But what you have here is the information for knowing what you need to be looking at next time you're looking at your next bill. So let's go ahead and go to the next one. This is for spinal injection. And what I've done here, and again, this is something that I've already had some attorneys, because I did part of this presentation for another one, they're already utilizing some of this to push back on opposing counsel about unbundling. So here's one about coding, the CCI edit for coding review for fluoroscopy that we were talking about earlier, the 76000. Okay, let's go to the next one. And then the 77003. And let's go on to the next one. And then the 36000, the introduction of a needle or intracatheter. And yes, they are introducing a needle or catheter, but it's being unbundled because that's part of like the 64491 when they are actually doing epidural steroid injection. Okay, next. Okay, and this is showing the CCI validation results and then also how you can back this up. And then let's go, I think the next page has the actual audit results. And so I'm trying to think how this is best easier for you to understand. But if you look at some of these codes, do you see the third one down, the 76000, $372, where I disallowed it because it was unbundled. And if we go back a couple pages, you will see where I've got the 76000. One more, yep. So if you show opposing counsel this will show them that it was unbundled. Okay, let's go back to the audit results. So what I've tried to do, let's go back to the audit results, please. Yes, so what I've tried to do is, let's go back one more, I'm sorry. One more. Keep going. Keep going. Okay, here we go. So here's unbundling of the surgery for the spinal injections. So the codes that I have unbundled, you see the 76000, the fluoroscopy for spinal injection, the 36000 for placing the needle in the vein, as well as the 94761 measuring oxygen blood level. I mean, $39. Think about it. That's when that little pulse oximeter goes on your finger. They're billing $39 for that. That's just unbundled and it's already included. So what I've tried to do is give you some information of how and why it's unbundled, if that makes sense. Okay, let's go on to the next one. So here's some bill charges for shoulder surgery. And so you'll see the codes, the third column from the right, the 29805, 29826, 29807, and 29819. Let's go to the next one. And you'll see that 29819, arthroscopy shoulder with removal of loose body. I've given the description and what can be disallowed. Go ahead and go to the next one. Here's a 29805 and the next one. And here's the audit results. So you can see I have two codes, the 29805 that was unbundled because it's already included in another procedure, as well as the 29819, the shoulder arthroscopy surgery. And so those two bills alone that were unbundled, that's $9,000 and $7,500. So that's $16,500 just right there that were unbundled. So this is, you can see why it's so important to look for the upcoding and the unbundling. Okay, next. Okay, so here's some bill charges, and you can see over to the second from the right for a knee surgery. And you've got the 29870, 29875, 29876, and the 29881. Let's go to the next one. So here's the issues with a couple of these codes. So here we have the 29870, and next page we have the 29875, and then the next one. So you can see that the two codes that we just showed you are unbundled from the 29876 and the 29881. And so again, this is two codes that if you're looking at a knee surgery, like, you know, any kind of meniscal repair or I call it just cleaning whatnot, whatever for the knee. If you see these two codes, they are probably unbundled from the other codes that were already built. And so this one is 4,800 and 5,400. So you can see where you're looking at some serious dollars. Okay, next. Okay, here's unbundling of spinal surgery. And here's a bill for spinal surgery. And again, it looks kind of like overwhelming, but you can see the second column from the left. We've got the CPT codes, and we're talking some serious dollars here. Okay, next. And then we have the things that we frequently see that are unbundled. The 22630, next. The 63056, next. 69990, next. And a 20650, next. 95940, and go ahead and go to the audit results, next one. And you can see that there was, for the unbundling, the 22630 for the lumbar spine fusion, that's $24,000. And then the next one, the 63056, the decompressed spinal cord lumbar, is $23,000. So again, we are looking at some really major serious dollars that payors, if they're not auditing the bills, are just putting down a price that, you know, even if the one that I'm going to say that I disallowed, the 22630, the lumbar spine fusion, $24,000. Let's say that at the 85th percentile, that's, I'm going to say $6,000, and average contracted rate is $3,000. That is still significant overcharging that should not be being reimbursed or be considered for reimbursement. Okay, next. Okay, here's some more audit results for the microsurgery add-on, you can see that it's disallowed, and that was only $3,200. And then the insert and remove bone pin. So anyway, it just goes on, but I just want to share with you that these are some serious dollars, and these audit results are an actual usual and customary that I have done for review. Next. Okay, before we go into helpful tools, are there questions over what I've gone over thus far? I know I've been giving you a lot of information thus far. No? Okay, then we'll keep going. Here's some helpful tools. A lot of you are probably looking at this going, how do I know what to disallow or not allow, or what's unbundled or what's not bundled? There is a program by AAPC called the American Association of Professional Coders that's called Codify. And I want to say it's like $300 a year per user. But what I've had some offices do is they'll have like a paralegal or something in their office that is the one that reviews all of the bills and runs them all through to see if things are unbundled. I always like to say the CPT Code Book is a necessary tool. It's something I take to jury trial, and I will hold it up and I'll say, this is like the Bible for billing and coding. It's put out by the American Medical Association, and they're not just guidelines. These are, I call it rules. There's an ICD-10 website that we'll go over, Fair Health Online, professional fee books, and telehealth references. Okay, next. Okay, so Codify, this is sold and supported by AAPC, that's American Association of Professional Coders. That's what most coders belong to that are reputable, and subscriptions are anywhere from $199 to $274. But they go over correct coding initiative and the NCCI edits. And so this is just something that is really good for, it's a little bit technical, but I think once you get, like someone in your office, it's really an expert at it. It's really good information and can save you probably that. I've had one office tell me that their one paralegal, they have saved in the last 3 months since I gave the presentation, they have saved her annual salary just by having her look at this. Okay, next. CPT Code Book. It's put out every single year and codes are updated. I think for 2022, there was like 500 changes or deletions or additions, new codes. So it does change. It's a very active process that does occur. And this is $109 on Amazon. And again, this is something that I take with me to jury trial. And I think it makes a big impact when I can show this to a jury and say, this is the rules that are put out by the AMA. I am not making up the rules. I'm state of California, the state of Michigan is not making up the rules. These are the rules for the physicians in the United States that they're to follow for medical billing and coding. Next. We all like free, and I love this website. This ICD-10 website. And what I like about it is that it has coding references, but until 2015, we were using ICD-9 codes. And so it gives the interchange between them, but it also gives a lot about HCPCS codes, like your durable medical equipment, things like that, ambulance, etc. So that, and free is good. So I use this almost on a daily basis. Next. Okay, Fair Health Database Online. Everyone wants to know, how do you get the pricing? I utilize a database called Fair Health. Fair Health is a database that I call it when I'm talking to a jury, I call it the Kelly Blue Book of medical bills. And what it does is it does not tell me what to bill out or what to allow. It gives what other providers in the local area are billing out at, as well as what they are being paid. And as far as by commercial payors. And so What I have, and this is part of my PowerPoint when I'm at jury trial, is to show you that it's not proprietary information. Fair Health database online, you can pay for what you use, or like myself, I buy the verbose version where I have the entire United States on an annual basis. But this is great because you can only pay for what you use. Next. Okay, here's 2 professional fees for usual and customary pricing. And these are good resources for you to have just as references. And the National Fee Analyzer is based on Fair Health database. It's $199 on Amazon. And then Context for Healthcare, which is another database, it's $143 on Amazon. And what I think is really good is that these are the only 2 databases that I am aware of that go out to the 3rd digit of the zip code. So for instance, some databases have Michigan broken into, I want to say 4 geographic regions or 6 geographic regions. Fair Health has Michigan, I think, broken into, I want to say it's like 17 different geozips. So a treatment provider in Saginaw is not being reviewed at the same way as a physician in Detroit. They're each looked at in their own 3-digit zip code. Okay, next. Both books include the usual and customary pricing at the 50th, 75th, and 90th percentile, as well as Medicare pricing. And I know Medicare is very important right now in Michigan because of the fee schedule that went into effect, I believe it was July 1st last year. And that's something that I can do. And so what I've been doing when I do reviews is that I'll do a usual and customary and average contracted rate for anything before July 1st. And then if it's after July 1st, I'll do the Michigan fee schedule. Okay, next. And that wraps up what I have as far as information to present to you. I am open to any and all questions. Where do hospitals post the charge master data? If you go to the hospital's name, you know, like I'm going to say Cedars-Sinai, you go to Cedars-Sinai and charge master, and it will take you to that. And again, what's really good about, you know, depending on what you're doing as far as negotiating with a hospital, is we have a checklist that we can send to you for the hospital compliancy. And I found that I've been able to sometimes really get good negotiations when I'll say, and your hospital is not compliant with the law that passed January 1st over a year ago. And I can sometimes get that. So if you want a copy of the compliancy checklist that takes that 83 pages down into about 3 pages, let us know. Is there a website that defines what falls? The website for CPT codes, I find that it's better to have the book, the professional edition, because if you go to just the, you know, looking up a code on the web, it's not as specific as what it should be. Am I answering your question? What or why is, I did not get that prior one. What or why? There was something about DRG. Can you put it up again, please? Or Matt, can you tell me what it was?
If you click on the checkbox, it should open so you can see all of them.
Oh, I'm sorry. Okay. Oh, what is the difference between DRG and CPT? And does Medicare recognize DRG codes? Okay, yes, Medicare does recognize DRG codes. And the difference is CPT codes are when it is just a procedure, like for a day procedure. DRGs, diagnosis related group, is when it's an overnight hospitalization of the hospital. So the only time a DRG will be utilized is when it's an overnight hospitalization, and CPT codes are utilized for all of the others, or the HCPCS codes. And I think Kevin Worth's question about, is there a website that identifies the full description of what falls under a certain CPT code so we can identify it? What I would really recommend is, if you're really interested in this, is to sign up through AAPC for that program Codify, because yes, you can look up every single code. It will drive you totally nuts, or it does me anyway. But this Codify is great because you can put in all the codes and it will tell you which ones are unbundled.
Looks like that's it for questions.
Thank everyone for the time of attending, and I will let Diana close. And again, I'm also open for questions, and I guess the copies of the slides are going to be part of the recording, if that's correct, Matt. Is that correct?
They'll be sent to all attendees after this concludes.
Mia, can you start my video, please? Perfect. So before I thank Tammy for sharing this information, I just want to acknowledge, I don't know how the other lawyers who are logged in feel about this. I find it extremely complicated. And so in most cases, no, not most, every single case that I have needed a bill audit review, I have had many cases with Tammy where I've submitted bills and medical records. Those two have to go together so she can analyze, what the care and treatment is. But what comes back from her is fairly comprehensive reports, but easily understood by the lawyer, because she's got columns when she's comparing whether it's a UCR at 50 or 75% or 80%. In some of my recent cases, she's also given me secondary information regarding whatever the billed amount was versus the Medicare amount. And the discrepancy between the numbers is pretty staggering. And I try to get that early in the litigation. And then it's always attached to my case evaluation summary so that the other side can see, look, we've got an expert witness who, if this case doesn't resolve at a reasonable amount, she's going to be with us at trial to explain to a jury why these charges are extraordinary. And in particular, one of the biggest areas that we've dealt with has been the surgical centers. So anyway, she's very good and she's been extremely helpful in my practice. So Tammy, thank you for taking the time to talk to us. And we appreciate it. And thank you for sharing not only your knowledge, but your the information. Your PowerPoint presentation will be available. So on behalf of all of the lawyers who've had the opportunity to hear you speak, thank you very much.
Thank you for the opportunity.